A concussion is a head injury that is diagnosed on clinical exam, usually without any testing. It results from a direct or indirect blow to the head. You may or may not lose consciousness with a concussion. A concussion can cause changes to a person's behavior. Signs and symptoms include headache, nausea or vomiting, poor memory, amnesia, increased sleep or sleeplessness, depression, and anger, to name a few. Studies have shown that brain cells that are concussed function at a lower level compared with normal brain cells. Recent studies have also shown that refraining from sports and other physically demanding activities assist in the recovery process. Refraining from challenging mental activities also helps lessen the duration and the severity of post-concussive symptoms. The severity of the concussion will determine when you can return to sport activities. The duration of your symptoms will determine when you can resume normal activities, and you will need to follow up with your primary care provider to determine when this is. After the diagnosis of a concussion, it is important that you stay with someone responsible for the next 24 hours. They will need to make sure you do not have any confusion, increased sleepiness, or a change in your behavior. They will also need to wake you up every 2 hours or so for the first 12 hours. You will also need to refrain from sports and other physically demanding activities. In addition, you will need to avoid mentally challenging tasks. You may take Tylenol if needed for the pain. It is important that you follow up with your healthcare provider within 1 week. At this point, it has been determined that you can be discharged. There are some instances when your condition can worsen. Therefore, it is important to return to the emergency department if you develop the following: worsening headache, persistent vomiting, visual disturbances, fever, presence of clear or bloody fluid from the nose or ears, confusion, new symptoms develop, or your condition worsens.